Hi everyone, how are you all? Welcome back to my channel. I'm so happy to record for you another video about my Diploma of Enrolled Nursing. In today's video, I want to talk more about your semester 2 and 3 placements. Okay, if you haven't watched my previous video explaining to you what you will be studying during these 2 semesters, please have a look in the description box below. I'll leave a link to that. Just in my opinion, watching that video will help you to understand and see the picture in whole rather than just watching this video separately. Okay, so let's start. I want to cover in this video a few aspects: which wards you will be sent to, what you will be expected to do during your placement, and also I want to share with my own experience what I've been doing during my placements. And I want to also talk about don'ts and do's, because during your placements you will need to work in your scope of practice, which is really important. And I just want to again share with don'ts and do's just according to my own experience. Okay, so what wards you will be sent to? You may be sent to medical, to surgical, to rehab, to day of surgery unit, to PACU, which is your post-anesthesia care unit. You may be sent also to surgical orthopedic ward. You may be also sent to delirium wards, and so on. Every place is different. And just to mention that you will be sent either to public or private sectors. So your public are the hospitals, and privates, there are also private hospitals and also GP clinics. From my experience, most of the students would spend most of their time during placement in hospitals rather than in GP clinics, but I've seen few people who've been sent to GP clinic for about a week or so of placement. Okay, so saying that, it means that every hospital is different. It has so many different wards, and whatever agreement TAFE has with that hospital will define which wards you will be sent to, because they have an agreement which wards students will go to, so that will differ as well. Okay, so from my experience, I've been sent to 5 different wards. So I've gained experience basically in these 5 different places during my placements in semester 2, in semester 3. Okay, so when you start your placement, okay, they will tell you that you will need to show up on the first day for a pre-brief. Okay, as explained in the previous video, for every placement you will have a facilitator who will be helping you as a student while you're doing your placement. This facilitator can be working either in a hospital. He might be their employer, and he will have a different responsibilities, and one of those responsibilities will be looking after students during their placement. Or you might have a facilitator that was allocated by TAFE through the agency. Doesn't matter where the facilitator comes from, their responsibilities and the support and everything they're going to provide for you is going to be exactly the same. So on your first day when you arrive to the hospital, you will be having a pre-brief. Okay, during this pre-brief, your facilitator will briefly explain to you or remind you your scope of practice. They will take you through the hospital wards and show you how they look like, what each ward is about. So basically they will explain to you really briefly why patients are particularly in this ward and what's happening in that ward. Then they will show you evacuation plans in terms of emergency, and then they will give you some papers to fill in. Also, they will check your folder with all your immunization proofs, your police check, your blue card, and all of those documents that you needed to prepare prior to your placement. So please make sure to take it with you on your first day of arrival. Okay, so your placements may be AMs or PM shifts. If it's AM, most of the hospital will have it either from 6:30 or 7 o'clock till 2:30 or 3 o'clock, sometimes until 3:30. Some hospitals for PM shifts will have it at 2:30 starting, or 3 o'clock and finishing either at 10:30 or 11 o'clock. Sometimes it's 11:30. Okay, don't think that if you will have today, let's say PM shift, you will need to rush to the hospital next day for morning shift. That is not going to happen, because by law you need to stay at least 8 to 10 hours having rest or sleep, whatever it is, and then only going to your next shift. So basically what will happen, you will have AM shifts, let's say your first week, or let's say 5 days, then you will have a day or two off, and then the next week they will switch you for PM, and then you will have, for example, 2 days off, and then either will be switched again to AMs or PMs. So every student is different, but you will have opportunity to see what's happening in hospital in terms of patient cares during AM shifts and PM shifts, because the procedures and routines are a little bit different when it comes to cares. So they want you to experience both. Okay. After your pre-brief is finished, okay, your facilitator will send you 2 wards. Okay, so each student will go to the ward that was allocated to them. Okay, you might have, let's say, 2 students from your class at the same ward with you, or you might end up just being alone there and have different students from different facilities. Okay, like for example from TAFE, from different area, or you might have RN students with you from university. Okay, because they all go sort of like in the same time to have their placements, so you're never going to be alone. Like you will always have some students with you on a ward, and just you will feel more comfortable that you're not the only student there. Okay, once you've been allocated and sent to your ward, okay, you will basically start as any other nurse. So what I suggest to you to do first before you start, just come out, you know, speak to the nurses, just greet them, you know, introduce yourself, say I'm such and such, I'm a EN student, you know, I've been allocated to this ward for this shift, and I would like to get a nurse buddy to assist me. Okay, so usually when you look at the board in the nursing station, you will see that they have allocations. So they will have nurses that are allocated for this shift, and they have beds or rooms beside each nurse name that they will be looking after. So basically in public sector you will have 2 nurses looking after about 8 beds, so it's like 4 beds per 1 nurse, but they work together, 2 nurses, so they work 2 by 2. In public sector the ratio might be a little bit higher, could be sometimes maybe 9 beds per 2 nurses. Okay, so technically you will need to get yourself a nurse buddy that will be assisting you in whatever you will be doing. Okay, this is why while you're speaking to them and introducing yourself, you can ask, who can I go with? And that nurse either can suggest you someone from the board and put your name beside those 2 nurses, or she can point out for you some nurses and you can speak to them as well and see who wants to be your buddy. So everyone are really kind and helpful and friendly, okay, when you need help. So don't be afraid to speak up, you know, and things like that, and ask questions, because you're a new student, you don't know things, so asking questions is very normal, you know, and just don't be afraid to speak to people. Like everyone really nice. So once you've been allocated with a nurse buddy, your nurse buddy can be either EN or RM, it doesn't really matter. Okay, and then you will see that they start in a shift by having a handover. So handover will be given to PM shift by AM shift, because they are already finishing their shift and they need to hand over the patients to the PM shift. So what I will suggest to you to do, take a handover sheet. A handover sheet usually is located in a nursing station and it's printed before every shift, so they always update it, because there are some patients discharging, there are some changes happening, so they always updating it, and before each shift starts they will print a new one, and that bunch of shifts will be lying down in a nursing station. If you don't know where it is, just ask one of the nurses. Together with the handover sheet, please take a planner as well. Planner is very important to keep you on track with your tasks. So I will just explain to you briefly what is handover sheet. Handover sheet is a piece of paper where you will have written all the patient names, and then their history, why they are in a hospital, what medications they are on, if there are any tests are scheduled for them, if there is any discharges scheduled as well, the mobility and things like that, if there is any devices in situ like IDC or cannulas and stuff like that. I believe that from hospital to hospital is a little bit different in terms of information given in a sheet. Okay, it depends how wide it is in terms of information, okay, or how basic it is. But in general, this just gives you an idea of why this patient is in a hospital and what's going on. Okay, and the planner, it's an empty planner, basically like an empty calendar when you put in your plans and tasks for the month. So this one is just for one day. It's a planner for one day. It will have columns going vertically, which is your time, let's say 1 o'clock, 2 o'clock, 3 o'clock, 4 o'clock, and so on until the end of the shift. Usually it's 23 o'clock, which is your 11 p.m. and then on side you will have empty blank lines where you can either write down a name of a patient and a bed number, or just a bed number. It's up to you. I usually like to write a bed number and the name of the patient, even though each patient will have beside their bed a little board saying date of birth, name, mobility, fluids and stuff like that, where you can actually, before you approach the patient, you can see the name and refer to patient by name. But for me personally, I like to write down patient's name into my planner as well, because when I look at it and I see what cares need to be done, I can see that bed, let's say 19, has Michael in it. I'm just making up any names. Again, this will just remind me who Michael is. Okay, so once you've got these two papers, you will be going with the nurses to take a handover. Usually this is happening by morning shift taking PM shift nurses to bed, from bed to bed of each patient, and telling you briefly what care's been done, if there's anything else been done, if there is any reaction to medication or it was a positive effect, if the patient, let's say had a shower, if the patient was repositioned and when the last repositioning was happening, if someone is bonded to bed and staying in bed most of the time, if there is any tests been done to that patient, or the test is are waiting to be done at evening time during your shift, or if that patient is for discharge. Okay, so whatever been happening during morning shift will be handed over to you. You are welcome to do any notes on your handover sheet. If you're a student, you might have a lot of questions, especially for nursing abbreviations that will be written in that handover sheet. You can highlight them, okay, while you're listening to a handover. You can highlight them, you can point it out for yourself, and once the handover is finished, you can talk to your nurse and ask her to explain to you what certain medical condition means, you know, what certain nursing abbreviation mean and stuff like that, and she will explain it to you. Try not to interrupt them too much during the handover shift. Just keep your questions for later, because handover procedure is very short, and it's basically the morning staff are waiting to go home, so they want to give you a handover and then go home. So don't stretch it too much by asking them a lot of questions. Better save it for later. So once the handover procedure is over, what I usually do as a nurse and as a student before, what I usually do is just I go through the beds and I take folder of each patient. I look at the OBS, previous OBS, which means your blood pressure, your pulse, your oxygen, your respiratory rate and stuff like that. I just see the QAD score, which is your main score at the bottom, just see if everything was all right, and I see when the next OBS are due. But in general, again, depending on the facility and policies and procedures in that facility, some of the nurses prefer to do set of OBS, which is your baseline set of OBS when you start your shift, on all the patients at once. And then from that time, you already see when your next OBS are. Because some of the patients are on 4-hourly OBS, some on 6-hourly, some on 8-hourly, and some on 1 or 2-hourly OBS. So this information can be also found in your care plan of each patient, and it will be given to you by the handover staff in the morning as well. So Once I've looked at the OBS, I can see that I will do one now, and then my next one will be, let's say, at 4 o'clock. So if I'm starting at 1 or at 3 o'clock, I will put one now, and the next one will be after 4 hours, according to what duration of OBS is for that patient. So I'll put, okay, Michael in bed 19 has OBS now at 15 o'clock, and the next one is going to be, let's say, if he's on 4-hourly or something, will be 8 or 7 or something like that. Okay, and I'll put the time for it. Then I will go to medication, and I will see, okay, his next medication is going to be at 4 o'clock. Okay, so I'll put for myself 16 or 4 o'clock meds time. The next one, let's say at 6 o'clock, Panadol, let's say. Okay, so I'll put 6 o'clock in my planner, go down to Michael, Panadol. The next medication round is going to be at 8 o'clock or 9 o'clock, and this could be more medication, so I will go to my planner, 9 o'clock or 8 o'clock, meds. And then in between, if I see there is any case need to be done, I'll put it as well. For example, a changing of addressing, you know, or repositioning. So I will see when was the last time repositioning done. Okay, so next one will be in 2-3 hours time, and I will put it in my planner as well. Okay, or for example, I will have a look if this patient is diabetic, which is usually is mentioned during handover, and it will be as well written down in a handover sheet. But I will have a look, is this patient on an oral medication or he is insulin dependent? Okay, so sometimes they might be checked for BGL, which is a sugar levels 4 times a day. Sometimes could be only 2 times a day. So I will have a look for all this information, and if there's any BGL checks, I will need to put it before meals time. Okay, again, this will go in my planner, and I will do this to every patient, okay, before I go on to my further tasks, because this will help me to plan my planner for the shift. And then also once one task is done, I will cross it over. But it doesn't mean also that during your shift you only rely on your planner. Like usually, for example, I know that, let's say 4 o'clock is the medication round. Okay, I know that in my planner it says that this bed and this bed and this bed has medications at 4 o'clock. Yet I will still go to every bed and I will just double check the folder and see that that patient either has medication round at that time or doesn't, like if there is any order for medication at that time, just to stay on a safe side. But in general, your planner will help you heaps. Okay, so after that you will do your set of OBS on everyone as well. And you as a student sometimes, well, in the beginning probably you will be assisted by your EN or RN body nurse, but you already have been practicing your vital signs and observations in your aged care facility, because you've been having your first placement in an aged care facility where you were practicing BGLs and OBS. So for OBS, you don't have to be always assisted by the nurse unless there is some difficulties, you know, in certain devices around the patient and stuff like that. But once you completed the OBS, please go to your EN or RN body and show your findings, show your total score. Okay, and if you do a pain assessment, also show it to them, because they will need to have a look, and then they will need to sign. Also, if there is any abnormalities as well, you have to show it to the nurse and say, look, this patient has a, you know, raised blood pressure, it's more than normal. So they may tell you, okay, let's just make sure you reassess the patient and do it manually better, because sometimes electronic machines can play around, so you can actually confirm if the blood pressure is high or not by doing it manually. So your body RN nurse can ask you to recheck and do it manually and show her the findings. You as a student will know how to do it manually as well, because this is one of your practices in labs. Because in labs we do not use electronic machines to do a blood pressure, we do it all manually, like an old style. So you will know how to do it, it's not really hard. Okay, so then after that, you and your nurse will be doing certain cares to the patient. So you will have call bells going on all the time. Someone will ask you to assist them to be taken to toilet. For some patients you will need to change the date of the dressings, you know, and if it needs to be changed, you will change it. Or if some dressings were leaking, for example, or peeling off, you will need to change those ones as well, and just assess the wound side. You will be repositioning patients, you know, because repositioning is very important for those who stay most of the time in bed, so they won't develop pressure sores. So you will be repositioning, and that usually happens with 2 people together, sometimes even 3, depending on I guess condition of the patient, also size of the patient, and things like that. What else? You might be having opportunity to do simple wound dressing or complex wound dressing, and you will be actually asked to be signed off in one of your log books that you will have on your placement. And I mentioned log books in my previous video, but I'll just say briefly. When you go on your placement, you will have a log book. Okay, in this log book you will have your journal, which is your reflections. Then you will have your tasks. So each semester you will learn in class and in lab certain procedures, certain tasks, you know, and then when you go on a placement, you will need to practice those tasks and need to be signed off in your book. So for that particular semester, you will have a particular tasks that you need to sign. One of those tasks will be your performance of doing complex and simple wound dressing. Okay, so if you have that opportunity, that will be wonderful. Your nurse can assist you with that. Or if you have few patients that have you know, wounds, and you will need to do dressing and you feel not confident yet, you can ask your nurse, can I watch you first, and then next time I can do it myself, and you can just stand beside me and correct me if I'm doing something wrong. Okay, do not forget about your hand hygiene with whatever you do. In any case you do not forget your hand hygiene. Do not use sanitizer more than 4 to 5 times. You actually need to wash your hands, and do not forget to change gloves. Never ever go with the same gloves from one patient to another. Even if you didn't touch something, didn't perform something, you know, you just maybe touching a curtain, you know, or a folder or something, it's still infection control precautions. Take your gloves off, you know, wash your hands, and then go to another person, you know, to perform cares or whatever needed to that patient. Infection control is very, very important, and you're not going to be reminded by your nurse all the time. She might remind you while you're doing, for example, intramuscular injection or subcut injection to wear gloves, but for everything else she might not remind you all the time to wash hands. You as an EN student, you've been taught about it in the class and in labs all the time, and you've been practicing literally in every lab session to wash your hands, you know, all this hand hygiene, so you have to keep it in mind by yourself. Also, while I'm talking about infection prevention, I just remembered that sometimes in a hospital you will have some patients that on airborne precaution or droplet precaution or any other precaution, or someone who is in a chemotherapy. So before entering to that room where the patient is, they usually have a sign either on a wall or on a door saying that this patient on such and such precaution, and depending on the precaution you will need to wear your PPE. Your PPE could be full PPE, which is your goggles, mask, gown, and gloves as well, or it might be only gloves and mask. Okay, so do not rush into patients' rooms without actually paying attention to the signs, okay, because somebody can be on precaution and you just rushed in without any PPE. Okay, so this is very important as well. What else you will be doing? So regarding injections, okay, they will be in your logbook as well, as I mentioned. Okay, great experience to do your subcuts is when you have someone who is insulin dependent, because that person will need everyday insulin injections to the tummy, and this is where you can practice your subcut injections. Again, if you don't feel comfortable to do it first time, you can ask the nurse to show you, but you already had like plenty of practice as well in labs, so you technically know how to do it. You might be just maybe a little bit scared to do it on a real person, so as I said, you can ask your nurse to show you first, and then next time you can do it yourself, because unfortunately we have a lot of diabetic patients in hospitals, and they don't come because of the difficulties of diabetes. They come for different conditions, but one of the cares that you will be providing, you know, will be insulin administration. So it's a great practice to, great opportunity to practice your subcut. As for intramuscular injections, I personally didn't really have a lot of experience during my placements. Like I had one or two, but not as often as I would do subcuts, for example. But if you have an opportunity, definitely try it, you know, because again, you will need to sign off on that. What else you will be doing? I'm just trying to remember. Of course, you will be doing medication administration. Okay, medication administration is probably the biggest thing during your placement, because first of all, you will need to follow so much of safety when it comes to administering medication to real people, and you will need to be always assisted by the nurse. So generally, you won't be allowed to go to a drug room for certain schedules of medication by yourself. Besides, it has a PIN code anyway. So the only way for the students to get into drug room, it's only with their buddy nurse. And also you won't be accessing it by yourself, the drawer of the patient beside the bedside with certain medications there as well. You won't be allowed to access it on your own. You have to be, again, assisted by your buddy nurse. So when it comes to medication administration, okay, always check the order and all the 5 rights for the patient and stuff, okay, together with the nurse. She will train you and explain to you all of that, but also you will know this theoretically from your classes as well and from your practices in labs. Okay, after that, either the patient will have their medication, whatever been ordered for that time, in the drawer, or if it's a schedule 4 or 8, you will have them most likely in drug room, where you again will go with the nurse. For the schedule 4 and 8, you will have another nurse coming to you guys to do the double check with your RN or EN nurse, and you as a student, you can't be that second person to check medication because you are still a student. So you will be like a third person just learning, but there will be 2 nurses doing checks. So the checks will need to be done in the drug room and then beside the table, so another nurse will come with you to the bedside to the patient to administering drugs. Sometimes the more confident you become, like maybe after a few days of your placement or so, your nurse will allow you to do things sort of not by yourself, like alone, but she will allow you to have a look at the order of the medication, check all the 5 rights if the medication order is valid and stuff like that, check it against the patient. Then you will go together to the drug room, and she will allow you to look for the medication in the drug room, to locate it where it is. Usually it has in alphabetic order. You find the medication, okay, and you prepare the medication, you know, you calculate how many tablets needs to be given, you know, if it's an oral medication according to the order and stuff like this. Maybe you will need to break some tablets and stuff like that, and you prepare it into a small cup. If it's a multiple medications need to be given to the same patient, let's say 2 or 3 different medications, you will be preparing few of them. She will be standing beside you and she will be checking obviously the medication that you're preparing. You have to do double check with her all the time, and then it will be another nurse coming as well, depending on a schedule of medication, to do that check as well. And then you will take the folder of the patient. We usually put the drugs inside, and you will go to a patient bedside, okay? If something happened on your way while you're walking with your nurses to the patient bedside, let's say someone called them in, there is an emergency happening in a different room, you know, and they need to rush there, never assume that you as the student can go on with the medication and administer it to the patient by yourself, because you might think, oh, all the checks been done in the drug room, you know, they know what I'm giving, it's okay, we've calculated it all, now I can give it to the patient. No. Never ever do that, okay? Even if you're holding medication, you always have to give it with the other nurse, and the last check needs to be performed near to the bedside of the patient. Again, you have to check it against the patient's wristband, checking the name, UR code, and also date of birth. And you have to ask the patient to do it, unless there is a palliative patient and they don't talk. So yeah, so medications are very important. Always do it with the other nurse. Never give anything by yourself, even if you've been left alone with the medication in your hand. What else? So also I want to mention that from my own experience, but again, it depends on a facilitator, I guess. I had one of my facilitators that was checking us as students in that way, that she offered us, once we became a little bit confident, again this will happen maybe in the end of your first week, you can take a load of 2 patients, okay? So you can, out of 4 patients, okay, you can take 2 patients, choose 2 patients to look after. Again, you will be doing all the cares with the assistance of the nurse, but you will take initiative by checking, okay, is this patient is up for OPS, is he due now for, let's say, BGL check, if he is due now for medication, okay, what type of medication he's due for, is he due for repositioning and stuff like that. And you will be the first person who would go and answer the call bell of that patient if they will be using their buzzer, you know, and see what they want, whether they want to get up, whether they want to be repositioned, you know, to feel more comfortable, whether they want to go to toilet and stuff like that. So while you're doing that, while you have chosen 2 patients, you will need to choose 2 patients, different patients every day. Do not choose like the same patients. So let's say if you happen to have looking after the same beds next day on your shift, try to choose different patients from those rooms. Okay, so once you have chosen 2 patients, she will tell you, your facilitator will tell you, okay, I want you to research what conditions these patients have and why they're in a hospital. You can see this from the medical history, but if there are some conditions you don't know what they are and what's happening, you know, with the body during those conditions, you can search it up. You can use Google, you know, you can use your phone. You can tell to your body nurse that, can I please go and use my phone, I need to research this because my facilitator asked me, you know, or you can directly ask the nurse and explain to you certain health conditions. Okay, then you will need to research what are those medications are that the person is on. Like, for example, if person is on medication for hypertension, if person is on medication for diabetes and stuff like that, you know, you have to research what the medications are used for, what are the side effects, okay, and things like that. And then you will also need to document in your planner or in your handover sheet, whatever you want to use, what care has been done to that patient. So what the facilitator do, once you've done all of that, she will come to you anytime during your shift and she will call you out and she will sit down with you somewhere in the corner and ask you, okay, can you tell me which patient did you choose? Tell me please, what is his medical history, what conditions he have, and then you have to explain what the conditions are, and then she will tell you, okay, so he's on this and this medication, what is this medication for, why is he having this medication? Or she will ask you what are the side effects of this medication, because you as the nurse, you need to know basic side effects of most of the medication that we administer, because we need to know what to look for if someone develops any side effects or adverse effects to a medication that we administer. And then she will ask you, okay, what cares so far you've done today for that patient and why those cares need to be done and stuff like that. So again, as I said, every facilitator is different. Some facilitators, they have different approach in terms of checking how you perform during your placement. It's nothing bad about it, nothing scary really. So they give you opportunity to research. It's not like they're asking you to remember you're studying from the class and that's it. You can use books. You can ask your nurse to give you memes or Harvard out of the drug room, and you can sit down somewhere quickly and say, can I have 15 minutes time so I could research all of that, because my facilitator will come to ask me these things. So that will allow you to do that. Okay, so yeah, and you know what I've noticed by doing that, I'm actually really grateful to my old facilitator when I used to do my Diploma of Nursing, because by practicing that every shift I've learned heaps, and I've made notes as well, you know. So this just make you to remember things, this just make you to understand things more as well. So yeah, it was really great. What else I wanted to mention? While you're a nursing student, okay, do not afraid to ask questions, okay? There are no stupid questions. All our teachers, I remember at TAFE, told us that there are no stupid questions. You can ask any question you have in your mind, basically. And when you are a student, okay, you are learning so much, and because you're learning, you don't know so many things, you know, and it's better to ask than do something wrong or assume something wrong and then remember it wrong, you know, and it will become a bad habit. So do not be afraid or shy to ask questions, okay? You can ask your body nurse, you know, if they are busy, as I mentioned before in this video, you can write it down and then ask later, okay? So this will help you to, as I said, remember things right. This will help you to understand situations better, you know, and of course will provide a better care because you will know things correctly rather than doing mistakes. Okay, so when you will be doing all your cares and stuff like that, by the end of your shift, you will need to do progress notes. So as a nursing student, you've been practicing doing progress notes pretty much in every of your lab session at TAFE, and that already has given you some sort of knowledge and experience of the format of the progress notes, how to write it, what to put in and stuff like that. So when you will be in the real world, after some time of your placement, you will be asked to practice to do progress notes. So in the beginning, what I suggest you to do, take the folders of the patients. These are different folders, so each patient will have a folder that is new to the bedside, that will have care plans, OBS charts, fluids chart, food chart, and so on. We'll have medication chart and stuff like that, but then more about the history of condition and health conditions for the patient and all the observations and stuff that's been done in the operating theaters from other hospitals. This sort of folder is bigger and thicker, will be allocated in the nursing station. So this is where you will be writing your progress note, in that folder. So in the beginning, while you're gaining more experience in the real world, you can open up the folders of each of whatever patients in that ward and just have a look how the other nurses were writing handovers. You will find a lot of handovers there by the doctors, by the physios, by the speech pathologists. Just look for the ones that's written by the nurses and just have a look at the format of it, what they were writing inside, you know, how they use abbreviations, you know, what is the style of writing, what is the order of writing as well, and stuff like that. And just, you can even point out some notes for yourself somewhere, you know, in your chit-chat paper, you know, or a notebook or something, so you could use it when you will be writing your progress notes. So when the time comes for you to do your own one to help your nurse, she will advise you to take a draft piece of paper, okay, just a blank piece of paper, write down your progress notes on 1 or 2 patients during that shift that you've been performing, and then show it to her. By doing this, you will save a hassle and stuff of doing mistakes in the official document, which is your folder, you know, for each patient, because that folder is read by so many other health professionals when it comes to looking up things about particular patients. So it has to be neat, it has to be professional, it has to be correct. This is why they will tell you, please do it in a draft paper. Give it to your body nurse to read it. She will either fix things up or she will add more things if you miss something. And once that is done, she will tell you, okay, now it's good to go. Please write it down into a folder and co-sign it with me once you finish, okay? So the more confident you become towards the end of your placement, you may even want to write all 4 progress notes for all 4 patients that you've been looking, okay? It's up to you really, or you can take half. What else? In the end of the shift, okay, it will be a handover. Now this time it will be you giving handover to a night coming shift, okay? You as a student will not be required to give a handover in your first days or even a week. If you feel comfortable in your 2nd or 3rd week, you can, with the assistance of your body nurse, give a handover about those 2 patients that you've been allocated to look after to the next shift. It's easier for you this way, because when you choose 2 patients to look after, as your facilitator would ask you to do, you know those patients, okay? You know what cares you provided for them, you know what medications they are on, you know, and you saw whether a positive or negative effect from the medication that was given, you know the pain score and stuff like that of that patient. So it's easier for you to give a handover about those 2 patients to the coming shift, okay? So just practice your handover using EASE-BAR. Okay, this abbreviation can be found in your materials for TAFE or in Google if you forgot, you know, and just use those sort of steps to guide you how to give a handover. But as well, before you start by yourself, just pay attention to the other nurses, see how they do it, okay? Try to maybe put some notes for yourself and things like that. Okay, my next advice to you is, when you go on your placement, take a small pocketbook or an address book, okay, or an index book it's called, okay, where you will be writing your medication. Why I'm suggesting to take a small one? Because you can put it either in your nursing pouch or in a pocket, you know, and it can fit easily, so you can access it easily and quickly when you need it. As I mentioned in my previous video, you can either buy index book, or you can make your own one and just put the letters in it. So you can write down medication according to the section of the letter in your notebook. This will help you to remember medication better, and also in situations when your nurse can ask you, okay, Yana, can you tell me why we're giving this medication to this patient? If you do not remember, you can quickly take out your book and you can have a look and tell her what this medication is for, okay? And use this book on every of your placement, on every of your shift. If you today have been given certain amount of medication to the patients, write them down. You don't have to put it right to the book at that moment. You can write them down on a piece of paper, and then at home you can organize it in a better way in your book, writing down what I usually do. I write down name of medication, possible routes of administration, what it is used for, and side effects. Okay, that's all what I write. That's enough for me, really. All of this is accessible in internet. You can use Harvard, you can use memes, you know. If you don't have Harvard at home, you can access internet. If you're in a hospital, most of the drug rooms would have memes and would have a Harvard nursing guide to drugs. Okay, so that is that. I'm just looking quickly in my notebook if I didn't forget things. Oh yes, regarding your IV pumps. Depending on a facility, you as an EN student will be either given or not opportunity to assist the other nurse with IV infusions. That could be even through burette or through push or bolus. You know, you will be given maybe opportunity to prime the line and prepare the medication and mix the medication according to the yellow injectable drug books with your nurse. What I've noticed that public hospitals do not give this opportunity to the students, whereas private sectors do. So again, private sectors again differ one from each other. Policies and procedures are different. So you as a nursing student just always check policies and procedures of that particular place that you are having your placement in, okay? So if you've been given that opportunity with the pumps, you know, IV pumps, you will do certain tasks with your RN or EN nurse. She may allow you to mix medication. She may allow you to prime the line, okay, and then she will, for example, put up the pump. She will turn it on and she put all the medication in and stuff like this, in the rate and stuff like that, okay? If you do not have the opportunity to do that according to the policies and procedures of that place where you are having your placement, do not ever touch the pump. And also, even if you have opportunity, if it's a public sector, I would suggest you do not touch the pump without assistance of a nurse. Sometimes you will find that patient, for example, close the arm, and of course they have cannula here. By closing the arm, it will alert the pump to stop the infusion, and it will start to beep. Okay, you will hear that beeping. You will go as the student, because it might be one of the 2 patients that you're looking after. Do not practice on pausing pumps, you know, or doing something, or turning back on, you know, pump. Do not do it as a student. Please wait for your nurse to come and have a look and do it by herself, okay? You can just go to her and tell her, look, such and such bed, you know, it has a pump beeping now, you know, and it could be that the person has just folded their arm. Okay, so this is my advice to you: leave the pumps to the nurses. Okay, because this is just the safety precautions as well. Okay, so just be mindful when it comes to IV infusions. Okay, and as I said, always follow policies and procedures, because sometimes even, you know, one of the nurses could tell you like, oh, can you pause the pump and I'll come in a few minutes. Okay, I would suggest not to do that. Just do not show also in front of the patient how to pause the pump, because I'll tell you that many people do not like beeping sound of the pump. It's so annoying. Okay, so if you show the patient how to pause it, it could be that the patient will pause it by themselves next time. So this is not safe. Okay, so just always wait for the nurse to come. What else? You will have 2 breaks during your shift. Okay, whether you do morning or PM, you will have 2 breaks. You will have short break, which is 20 minutes, like a tea break, tea time, and then you will have your bigger one, which is 30 minutes. And that one, either your lunch if it's a morning shift, or your dinner if it's a PM shift. Okay, you can go together with your nurse, with your body nurse, to the break, or you can go by yourself. Sometimes your body nurse can tell you, you go on your break, you know, and I will go after you. It's okay. So if you go in different times, you will be left with the other nurse. As I mentioned in the beginning of this video, you will have 2 nurses working in pair, looking after 8 to 9 patients. Okay, so if your nurse told you, you go on a break now and I'll go after, when she goes on a break after you come back, you will be with that second nurse, which is not technically your body nurse, but you can assist her and she can assist you by looking after your 4 patients that you're looking after with your body nurse, who is now on a break. So that second nurse can actually help you. So if any buzz is going on, you know, you can also go to her and ask you to assist. Do not do things by yourself just because your nurse is on a break. Okay, there are heaps of other nurses that can help you, so no problem at all. Also, regarding transfers, you will have some patients, obviously, due to their conditions and depending on which ward you are in. Like, for example, in surgical wards, a lot of patients come back from operating theater, so they have certain operations being done in their bodies. You know, their mobility is impaired during those surgeries, you know. So do not try to lift patients. Do not try to assess patient by going to toilet and something like that if that patient is to assist, or if that patient on a use allocated for a hoist use, you know, or certain moving equipment and stuff like that. Always check the care plan, because care plans are updated on every shift. Always check the care plan, see if that patient even can get out of the bed. Maybe the patient has a catheter, you know, and then they don't need to go to toilet to do number 1. It's only number 2, let's say, you know. So always check these things. Do not ever transfer patients to places if that patient is not allowed to be transferred. It has certain way of transferring, or that patient is to assist. Okay, because if that patient has a fall and have other complications and stuff due to that fall, you will be liable for that. So just remember always that we're dealing with the real people. Okay, we're representing us as safe practicing professionals. Even if you are still a student, just you're a professional and you have to be practicing with safe precautions. So this is my advice to you regarding mobilities. Regarding your uniforms, do not go in the same uniform to the next shift. Okay, this is why when I used to be at TAFE, I had 2 t-shirts that I would change. Okay, so I bought 2 t-shirts and once it's used, I put it for washing. I have another one for the next day. Okay, I had 2 pair of pants and I had only 1 pair of shoes. Okay, you don't need to have 2 pair of shoes unless you really want to, but what you can do, you can use a taffy wipe in the end of the shift. You can just wipe your shoes if you think there are some bodily fluids or something like that on your shoes. Or sometimes I also use taffy wipes to clean my nursing bag before I go home as well. Okay, but your uniform needs to be always washed and fresh before you go on your placement. And you understand why. It's just infection control and stuff like that. You know, you might be carrying germs, you might be carrying bodily fluids and stuff like that on your uniform from performing cares and things like that. Okay, before I finish this video, I just wanted briefly to tell you quickly about two other units, which is again, my camera died because it's a long video. So just before I finish this video, as I said, I want to briefly mention two more units that you might have a placement in. So first unit is a day surgery unit, and the second one is PACU unit, which is your post-anesthesia care unit. Okay, so PACU, I'll start with the day surgery unit. Day surgery unit is a unit where you will be administering patients prior to the surgery. So you will have a certain documentation that you will need to fill in, you know, that will cover the previous history, the medication that the person is on, when was the last meal intake, when was the last time going to toilet, if the patient is fasting, when the fasting is started, if the patient on any blood thinners, that has to be mentioned as well. If the patient has any metal features inside, like a crown or a post somewhere in the body from the previous surgeries, that needs to be mentioned as well. So there is a bunch of papers that you will need to fill in prior administering this patient for the surgery. Then you will take the patient from the office of administration to the care unit, where you will prepare the patient to the surgery. You will change a patient into a gown, you will organize the belongings somewhere, and then you can put tats and scuds on to keep the blood moving in limbs, you know, and then the other nurses from operating theater and anesthesiologists will come to prepare the person and take it to the operating theater. Then once the operation is finished, you know, the surgery is done, the patient will come out to PACU unit. PACU unit is the post-anesthesia care unit, where that patient will be staying from about an hour to maybe 3 hours. It depends on how the person is waking up from the anesthesia, how the person is tolerating pain, how the person's vital signs are, and stuff like that. So that will this will depend how long they will stay in there. So while you're doing your placement in there, you will watch and observe and just write down all the observation signs. So the person will be constantly monitoring their vital signs on a monitor on a wall, and it will be written down every 5 minutes. But again, depending on the policies and procedures of each place, it might be different, but this is just my experience. Okay, and then after that, after PACU, person can be either sent to a surgical ward if the operation was big, complicated, or whatever. If the operation was very small, something very small, that person after PACU will be sent to day care, surgery care unit, day surgery unit. There we go. Back again there, and it will be staying there, and that person will be staying there for half an hour. Okay, or up to 1 hour. You as a discharge nurse, you will need to perform another set of obs before discharging person out of the hospital, and you will need to fill in discharge papers and then explain to the person, you know, if there's any medication being allocated for that person, why that medication is ordered for, you know, how to take it. Also, you will explain how to look after the wound site. Maybe some of the wound site cannot be washed and stuff like this, you know. And then as a discharge nurse, you will also remove the cannula, and you will also organize a pickup. So you will ask that patient, are you going to have taxi coming, you know, do you want us to book you a taxi, or do you want us to call your family or a friend or something like that, so they could come and pick you up. Okay, so that will be organized, and then you will take that person and you will walk them out to the hospital entrance and give the other slip of paper to the receptionist that person was checked out or discharged, whatever you call it. And you will need to see that the person was picked up either by the taxi or by the family member. Yeah, so that would be it pretty much. So you're not gonna have too much of days in these two units. Usually these two units students send you is to give you sort of like a whole image of what's happening to a person when they admitted for a surgery, because you as the EN student will be sent to medical and surgical wards, and it's nicer and more like better for you if you know the cycle of what's going on to that patient, you know, what he's going through from the beginning until the end. This is why after surgical ward you will also have shifts in medical ward, because some of the patients are moved from surgical to medical and then to rehab. So you will also have shifts in rehab to see how they are performing physically, how they are starting to walk back again, if they have a knee replacements, you know, and stuff like that, or hip surgeries, how they start to walk again, you know, how the physio assesses them and things like that. And you will be helping their SE and student as well. I haven't done my placements in rehab. I didn't have it. I had day of surgery unit, I had PACU, I had surgical, I have medical, I had surgical orthopedic ward as well, I had delirium wards, you know, and I had this, all of these wards, I had it in a different facilities. Okay, so, but the tasks that you were performing are very, very similar, okay, from the facility to facility in terms of cares. So I think this is all what I wanted to mention. I'll just quickly have a look. Okay, yeah, I think this is it. So before I say goodbye, I just want to remind you that your facilitator will be seeing you as a group about once a week. So they can tell you, okay guys, we're going to meet today for lunch all together. Instead of you having lunch separately, you will meet all together and have sort of like a debrief session or something, talking to your facilitator, you know, expressing your concerns or some good moments and stuff like that, asking maybe questions. And then in the end of your placement, in the last day of the last week, in my experience, what happened to me is that my facilitators were offering us as students to have a dinner or lunch together, you know, as a last dinner, and just have a little bit of fun together, you know, sitting at one table, you know, talking, chatting, and yeah, just friendly friendly dinner or lunch. Okay, so that was fun. It's good memories really, because you've been for 3 or 4 weeks with the same people working, you know, during this time duration, and you sort of became friends and stuff. So it's good to have that reflection sort of in the end, you know, to sum up things, you know, and things like that. And then when you finish your placement, you will be returned back again to TAFE. You will have your final debrief with your TAFE facilitator, and you will need to fill in a survey about your placement, you know, whether you were helped, whether you were happy with the help that were provided to you by your facilitator during your placement, whether you were happy in general with the placement and the facility and stuff like that. And again, if you will have any questions, you know, you can ask your TAFE facilitator as well. So yeah, so these are the placements that you will have during these 2 semesters. Okay, you will definitely love it. It's such a great experience. Just always remember, as a nurse, to stay safe, to stay in your scope of practice, and if you do know anything, just don't be shy or afraid to speak to other nurses. It's better to ask than do mistake. Okay, so yeah, if you have any questions, please leave them in the comments below and I will be happy to answer. I really tried to make this video as short as I can, but it's just I wanted to touch on certain aspects, you know, so you know, so you can know what it's like, what's happening during your placements. Basically, it could have been that I've forgotten some of things, you know, but like my last placement was almost half a year ago, so I'm just trying to remember what I had in my placements. But yeah, in my next video I want to film my experience in operating theater, because I had one shift there and it was amazing. Like, it's such a great experience that I can't describe, but I will try to. I want to make a separate video about it, and I want to tell you what I experienced. I'm going to keep the privacy. Obviously, I'm not going to be mentioning the facility or name of the patient, stuff like that. I'll just talk about the procedure, the surgery itself that patients can have, and that's what I was observing, and just my experience. How did it go for me? Yeah, so that would be my next video, and thank you for watching this one, and I'll see you in my next one. Bye.